Some people might wonder what public health has to do with dental health, but one thing I've realized through some reading is that dental health actually impacts more health aspects than just our mouth and our teeth.
Yes, that is true.
Welcome to the Southwest Utah Health Podcast. For the nearly 300,000 people living in the region, public health is the ounce of prevention that's worth a pound of cure.
This is Dave with the Southwest Utah Public Health Department. I'm here with Camille. Camille is from Utah Tech's Dental Hygiene Program, and so it's good to have you talking with us today. Some people might wonder what public health has to do with dental health, but one thing I've realized through some reading is that dental health actually impacts more health aspects than just our mouth and our teeth.
Yes, that is true.
So the work that you're doing right now, you're a student there, right?
I am. I'm a junior at the program right now.
And so it's a bachelor's level program?
It is. Some hygiene programs are an associate, but the one at Utah Tech is a bachelor.
And you guys get to the point where you do a lot of hands-on type of stuff. What are the current recommendations for toothbrushing?
Toothbrushing should be done every morning and night, and between meals would be great, but even rinsing with water after eating can help flush the food and like sugars off the teeth.
When it comes to kids, what are ways that kids can be taught dental health, even as when little babies start developing their baby teeth?
A parent can take a clean washcloth and rub it along the gums to promote stimulation and blood flow and keep it clean. And after they have their first tooth erupting, then you can start with like a very gentle toothbrush. You can buy like a little toothbrush that goes on the finger, and then you can brush the kid's teeth.
And then at what point are you teaching the kids to brush their own teeth?
Once a kid can tie his or her own shoes, they can brush their own teeth, because every kid wants to be independent. They want to be able to do like everything on their own once they're at that age, and so toothbrushing is another thing that they can do.
So you're saying even before the first tooth erupts, you can stimulate the gums and cleanse them with the washcloth. I guess I didn't know that. My wife probably did. But and then starting them off with the parent brushing their teeth with a toothbrush that's put on the finger. And is it soft bristled?
I think it's made of like rubber or like silicone. But once they have their molars, the posterior teeth in, you can use a regular toothbrush with soft bristles.
When do you recommend that kids get their checkup?
Right now, the recommendations, and it's been this way for as long as I've known, is every 6 months.
Okay.
Unless you need it more often if there's like gingivitis or something that they need to treat. But every 6 months is great. And for kids when they are younger, like 1 year old, 3 years old, they don't need the full appointment. Their appointments are going to be very short, just for the dentist to look and see and how everything is developing. And so their appointments won't be like an adult appointment, but it'll be good for them.
Is there anything that parents or adults can model for kids that I've missed as far as encouraging them or getting them into their own habit of taking care of their teeth?
I think definitely by leading the example, like by parents showing them they brush their teeth, they floss, and even taking them to their appointments at the dentist so the kids can watch their parents. It's like, okay, it is mom or dad's turn, the parents' turn to have a dental cleaning, and so when it's their turn, they know what to expect and they're ready for it.
Yeah, I'm thinking with whether kids go to get their shots or a checkup or the dentist, it's something a lot of kids are afraid of, or they think of drills or they think of pain. And so what are you learning as far as kids are concerned to help them relax and be more at ease in the dentist chair? And if you don't anything right off the bat, it's okay.
I reflect on my own personal experience. Right. Yeah, like as a child, I was afraid to go to the dentist. I did have a lot of cavities, and I didn't like to go. But as I've gotten more educated and learned how to take care of my teeth, I look forward to going to the dentist. So personally, that's why I came into the field, is so that I could educate people and children to have a better experience.
I like that. One thing I noticed with my two sons recently that had really bad checkups and had multiple fillings, they've been very motivated for this past year to brush and floss their teeth every day. It was not a good experience. So, you know, even one bad experience in a way can help them do something to make the next one better, where their goal is, I don't want cavities. We even had something in place, I don't know if maybe it depends on the family, where we even thought at some point of rewarding our kids if they didn't have any cavities. Not with candy or treats, but maybe a monetary award or a prize that if their checkup was good, we'd say, hey, good job. It means you've been brushing your teeth on a regular basis.
Yeah, that is a great motivator. Like having a reward for doing good, I think is a great way to help your kids to stay on top of their dental care.
Besides cavities, what other negative things or bad health conditions can come from poor dental hygiene?
As you stated at the beginning, like the oral health can affect so much more than just the mouth. We're learning that it's a reflection of total body health. For example, someone with diabetes, they have diabetes and they get gingivitis, which is inflammation and like more negative bacteria in their mouth. That can make that worse. And also the health of the mouth can make their disease, diabetes, worse.
And really, to kind of wrap things up too, for you, what are you enjoying about being in this program? I mean, is it what you thought it would be? Have you had any surprises along the way?
Well, it's like a full-time job. It's like 8 to 5, 9 to 5, Monday through Thursday right now. And there's a lot of lectures, a lot of learning about really just learning the basics and then going into deeper levels of what dental hygiene encompasses completely. And then we have full days of clinic where we get to see patients and we're starting treatment plans and caring for our patients and learning how it will be like when we work out in private practice.
And what are some options you can do with that? What are you looking at doing when you graduate?
I'm super excited to work in private practice. I'm excited it will give me flexibility and give me the opportunity to be a mom and a provider together. There's other opportunities. You can become a teacher. But that's what I did learn starting the program. There are more options than just clinic. Okay. Yeah.
But it sounds like you really like the idea of being in the dental profession when you graduate. You're wanting to go into private practice and keep going.
Yeah.
Well, thanks for being with us. We appreciate it.
Thank you for having me.
Yeah, you bet. And next we will have Mandy, who is an instructor with the dental hygiene program at Utah Tech University. How long have you been an instructor there?
I've been an instructor for almost 4 years now.
Okay.
Yep.
Do you know how long the program itself has been going at that university?
I graduated from there way back when, and I graduated in 2008, and I think it started it was either 2000 or 2002, somewhere in there.
Okay, so it's been around a while. It's got a good reputation.
Good reputation.
So you not only were a student there, but now you're an instructor there. Yes. What did you do in between? Did you go into practice of some kind?
Went into private practice, and I have been in I still am in private practice. So almost 17 years now in private practice.
And I imagine that's valuable to students that you're teaching them and you're in the profession.
Yes.
So you probably know some of the latest developments or things in every profession change, cutting edge type things.
Graduating, I knew I wanted to be an instructor, but I also wanted to be an instructor that knew what I was talking about. Besides just what you learn in the books, I wanted to actually go experience it. So I knew long term that was what I wanted to do, was get back into instructing after having experience.
Okay, great. Can you talk a little bit about the concept that dental health involves the whole body? It's not just your teeth in your mouth.
Absolutely.
If you take good care of your mouth, you're going to have better health overall, and if you don't, you might have some other issues. What are some of those issues?
Yeah, so one of the biggest issues is when you have your gums can get infected. So if you're not taking good care of your teeth, your gums can get infected. You get tooth infections as well, and that can also cause a lot of problems. But any infection in your body can spread. And so when your gums are infected or when your teeth are infected, it can then get into the bloodstream. It can affect your kidneys. It can affect your heart. If you have a prosthetic joint or a hip, it can reinfect that. So we have to know when you go to the dental office, you often have to fill out paperwork, and there's like 50,000 questions. There is a reason for every one of those questions. So make sure that you're updating your health when you go in, because there's lots of things where you might have to take an antibiotic before you get your teeth cleaned, and depending on what surgeries you might have had recently. So there's a lot of things that the mouth is just the entryway to your body. It reflects the rest of the body, so definitely.
Probably people don't often think about that.
They
that
don't.
You can get a dangerous infection through your gums or
Absolutely.
through
People
something
die
going
every
wrong.
year
Okay.
from it. And I have patients all the time, and I will ask them, have you had any medical changes? And they're like, nope. And then I find out after the cleaning, yep, I had surgery, but I didn't think you needed to know about it. Well, we do. So please, just answer the questions. Don't always think, oh, it doesn't relate to my mouth, because it very well could.
Okay. So besides just not brushing and flossing on a regular basis, what are some bad habits that people have that affect their dental health?
Yeah, great question. So Diet is a big one. And so there's a lot of cariogenic foods, meaning that they cause cavities. And you don't really think that they are a cavity-causing food because they're not always the sugar that we think of. We know candy. Everybody knows candy, right? But then you've got your sodas. And even if it's diet soda, meaning sugar-free soda, it is still very acidic. So people are like, oh, I'm drinking diet soda, I'm fine. And it's not. You're just bathing your teeth in acid all day long. Coffee's acidic. Energy drinks are acidic. Pretty much anything but water. Milk is basic, but it turns into sugar after you've drinking it. So then you're just pretty much anything but water. So it's not how much you're drinking, it is how often. Are you drinking that soda for 2 hours, or did you have it for 30 minutes at lunch? So if you can, I don't care if you drink 2 liters in 30 minutes versus 8 ounces in 2 hours. If you're bathing your teeth in acid for 2 hours, that's going to be a lot more damaging on your teeth. Maybe not your kidneys, but on your teeth speaking, then that 2 hours of soaking your teeth in acid is going to do a lot more damage than if you drink 2 liters in 30 minutes. Does that make sense?
Yeah,
so it's
interesting.
Frequency, not quantity. So people will tell me all the time, don't take away my soda. And I'm like, you can still drink your soda, but keep it quick and drink with water after. Swish with water really vigorously after. Those kind of habits will make a big difference. Another quick one is crackers. That's a salty snack. You don't think that that would be a problem, but it turns into sugar. It's simple starches, so it's going to turn into sugar.
And the crackers that you're talking about in either some of those savory snacks are actually gooey and sticking to your teeth a lot like candy might.
If you're going to choose a candy, choose chocolate. It melts faster in your mouth.
And I like that I just heard a health professional recommend chocolate. I think that's exciting.
If you're going to choose the lesser of
of evils.
I am a chocolate-holic,
right.
so you know that's that's my go-to.
Okay. What about smoking? Have you people that smoke? That's another thing that you're constantly inhaling, something that I know can stain the teeth, but can it cause tooth decay as well?
Cause a lot of problems. It's going to cause a lot of problems for your overall health, which we know a lot about, but definitely in the dental field as well. So, and now it's not just smoking. Now we're looking at vaping, and because they're making it all these sweet flavors, it's getting younger and younger. So these younger teenagers and tweens are starting to vape, and yes, so the smoking causes a lot of problems, and what it does is it dries out the mouth a lot, and it's a vasoconstrictor, so you're getting less blood flow through your mouth, so then your immune system's turned off, and so it gets to be really complicated, especially it doesn't actually cause gum disease. It accelerates gum disease. So if you have a healthy mouth to begin with and you continue your healthy habits and you start to smoke, you might not have these results. But if you have any bit of gum disease present in your mouth, it will accelerate it. So you're going to get more bone loss quicker. You're going to get more infection quicker.
Got it.
And so it makes it really aggressive. So I watched a commercial that I loved, and it was an anti-smoking commercial. And it was basically the guy was paying for the pack of cigarettes with a tooth. He was handing every time you take that pack of cigarettes, you're handing over your teeth.
So another question would be, we as adults, we know better, we're supposed to have good habits, it's kind of up to us, but when we have babies or little kids, it's kind of up to the parents to coach them and teach them on their dental hygiene habits. So what are some things you found that have worked as far as parents helping their kids get into those habits?
So I had a very strict dental home growing up for myself. My mom was amazing, and so she had strict rules. You talked about rewarding your kids. My mom made us pay. If we forgot to brush our teeth.
Was out of your pocket?
It was out of our pocket. So she had a jar, and if we forgot to brush our teeth, my older sister had to pay a quarter, I had to pay a dime, my little sister had to pay a nickel. And then we took that jar of coins, and if we had a cavity, that's what she used to pay for our fillings. But in my household, being a hygienist, my kids, I had my first daughter, and she was kind of giving me a little bit of trouble on not wanting to have her teeth brushed. And I says, not brushing is not an option. We can do this the easy way, or we can do this the hard way. And I basically one night laid her down and brushed her teeth, whether she wanted me to or not. And I says, now, if you will do it the easy way, I have a treasure box. And I did like a monetary thing. I had nickels and dimes and pennies in there. And basically, if she got 10, then she could go pick out a prize at the store, kind of a thing. And every night, she was like, okay. And she sat there and opened up her mouth wide, and I brushed her teeth because she wanted to get the prize. And so then she collected her coins, and then we went to the store. I think I gave her one prize. I think we took her to the store one time. After that, she slowly forgot about the treasure box. And then by the time baby number 2 came, she watched Big Sister sit down with her mouth open wide. My other kids did not give me trouble from there on out, so it was great. We talked about adults leading the example, and so I think having your kids watch you brush your teeth, having your kids watch you floss is a good, just being that example. Say, I did it, now it's your turn. When your kids start to hit 2 and 3, they can do a decent brushing job. And so you're thinking, oh, they're fine, but parents need to know they don't have the dexterity that you do.
Right.
So that's why Camille had brought up, if you have the dexterity to tie your shoes, you can have the dexterity to do a decent toothbrushing job. That does not include flossing. So parents, just know that you're in it for the long haul. Brush your kids' teeth until they're 5 or 6 years old, and then floss them from there on out until they're tweens and they can actually do a good flossing job.
I think that's a good reminder for parents that even if the kid wants to, if they don't know how or have the dexterity, that's probably not doing a
good enough
so
job.
Until that point, we need to get in there and brush their teeth for them.
And you also need to not be overbearing and do it for them. So you brush for a minute, and then mom's turn to brush for a minute, or dad's turn to brush for a minute. Or you brush in the morning, I will brush at night. The cleanest is at night. We want to have them go to bed with the cleanest mouth possible.
Now, do you have an opinion on the electric toothbrushes? I know with some of our kids, we had some of those that had a timer where they would go on for 2 minutes, so they were at least running around their mouths for 2 minutes. Is that
100%?
Does it do a good job?
I would definitely recommend an electric toothbrush for any child. Yeah.
All right, good. So part of the program you have over there, there's an actual dental clinic where people come in and get dental services for low cost. So if folks don't have dental insurance or they're underinsured, that's a great option that maybe they don't know about. Is it right on campus?
It is off of the main campus. It's over by the hospital. It's in the Russell Taylor Health Science Building. The greatest part about it is if you have a lot of gum infection in a private practice setting, that could run you anywhere from $500 to $1,000. In private practice for me, a deep cleaning like that, if you have a lot of infection, is going to take me 4 hours to clean your mouth.
Okay.
For a student, it's going to take a lot longer. We break it up into multiple appointments. The students take a lot longer. You will be paying with your time versus paying with your money. It is much lower cost for you to come to our clinic and have that deep, especially if you have a deep cleaning. If you have a simple cleaning, it's also cheaper and it won't take you as long. But if you're one of those that has that deep cleaning that you need that done, this is a great place because you're not only going to get the discount, you are going to get the best cleaning that you could get.
Wow.
We're going to have the student working on you. We're going to have multiple instructors coming and checking you. We take x-rays and we do a whole workup of your mouth. So you're going to get a thorough job.
If a person wants to come in there, do they need to call and make an appointment, or what's the best way for them to get?
That is the best way. Call our clinic. We will actually not make an appointment. We will put you on a list, and we have 24 students that have availabilities. So when they need a patient, they go to that list.
Okay.
And when we have cancellations, so they will call up and say, I need you now, or let's schedule you in a week or two, or whatever it is. We even offer a night clinic. It helps those working parents that can't take the time off work.
What population do you see yourself serving there? Is it all ages come in, or what's the bulk? So it's really across the...
So our students have certain requirements that they have to meet or they don't graduate. So sometimes people are embarrassed to come in and get their teeth worked on because often it's been a long time. We want you because you're worth more to my students for their grade. And so the more tartar buildup, the more infection, the more points for our students. So don't ever I hope that our community wouldn't let that inhibit them from getting care. And then also they need elderly, that's one of their requirements. They need children, they need adolescents, they need just a regular healthy meal. So they have requirements that they need. And so pretty much everybody and everything.
Do you serve, is it mainly St. George area, Washington County?
Our clinic is in St. George, and so because of that, it's going to collect more of the St. George population. But I have had patients that have come all the way from Mesquite and Cedar City, and they make the drive because they know, and they don't just come once and get their teeth taken care of. They are now regular patients there. They will make that drive every 3 months if they need. So if you have a lot of gum infection, we see you on a 3-month basis. So some come every 3 months.
So it's not just a one-time thing. You can become their provider for their every 6-month checkup or more if needed.
Yeah.
Okay.
A really cool thing about the Taylor building is we have actually partnered up with the U of U. And so the U of U has a dental clinic. So getting your teeth, not just we clean, but they fix. And so if you have dental work that needs to be done, we have a few dentists that come down from up north, and they actually work in that same building as us. And so they can provide discounted dental care. So if you have cavities or anything like that, or extractions that need to be done, it's all in the same building. So come to us, get your teeth examined and cleaned, and then we can say, hey, we see something that looks concerning, go see these guys. So it's all kind of a big partnership on serving our community.
So you connect them with that dental clinic that comes down from U of U. Anything I missed? Anything else that you want to mention about the clinic or your program?
It's a great program. We have amazing instructors that really care about our community and that also care about our students. And we are a very tight-knit community there. I love it.
Thank you, and thanks for all you do.
Yep, thank you.
This podcast was brought to you by the Southwest Utah Public Health Department. For more information, visit swuhealth.gov.